Oh, Gesundheit. I just sneezed, and that is not good live TV. But anyway, hi, I'm Dan English. I'm here. I'm the program coordinator for the Missouri Local Science Engagement Network, part of the Most Policy Initiative. And we got a doozy today. We're talking about public health orders and how what the Missouri legislature gets to control, and also Medicaid expansion. So without further delay, let's get our director Rachel Owen in here. Rachel just popped up. Hello, Rachel. How are you doing today?
I am great. Happy Friday, everyone.
Happy Friday. Currently have 4 people watching, so hello to all 4 of you. Make sure to hit that thumbs up button. We can see if you do. So you're in trouble if you don't. Rachel, today's got it's controversial to say the least. Big news in the legislature coming out of Missouri. Republicans didn't want to include money for the Medicaid expansion in the governor's budget. So, is there anything we can? What do we know so far?
Yeah, so one of the tough things about being in our position is that we get to talk about these science issues, but we also really try hard to avoid the politics, and we don't make recommendations to lawmakers. We try to stay pretty neutral. But things like this happen, and I think it's important for us to talk about them. And we're going to try to talk about them in a politically sensitive manner. But yeah, so a little bit of background here. So last summer, on the August primary, voters in Missouri passed the Medicaid expansion ballot initiative by pretty fair numbers. And so the governor, was opposed to Medicaid expansion at the time, ended up putting it into his budget proposal in January because he said the will of the voters, the voters approved this. And so we're going to go ahead and fund it. Even though a lot of the Republicans at the state level did really oppose Medicaid expansion for a lot of different reasons, mostly on principle. So, the governor makes a proposal for the budget, but ultimately the legislators get to decide how to appropriate money for the state. It starts in the House of Representatives. So this week, the House of Representatives went ahead and passed their version of the budget, and they decided not to include any sort of funding for Medicaid expansion. The chair of the budget committee put out a statement that they, fundamentally felt that it was not something that was in the best favor of the state. And they feel like it's within their constitutional rights to be able to not provide funding for it. But it sounds like, so now passed out of the House without the Medicaid expansion funding. Now the budget goes over to the Senate. The Senate has an opportunity to add it back in there, and then they'd have to come together, make a compromise bill before it goes to the governor's desk. So we still have a lot at play here in the next 6 weeks. That's kind of where we're at right now.
We're going to have to see how it all works out. Let's bring in Dr. Josh Mueller. Dr. Mueller has been following this in the Missouri legislature, and he's going to give us his big presentation on it. Josh, how are you doing today?
I'm great. How are you, Dan?
Pretty good. So let's get right to it. Can you lay out basically what's going on for us?
Sure. Yeah. So thanks, Rachel, for laying out the budget process here. I have some boring details to lay out about Medicaid. So hopefully your portion of the talk kept people on the line here. But I swear, stay with me; it gets more exciting. So I just want to back up really quick for people watching, in case you're not super familiar, and talk about Medicaid, the Medicaid program in general here. So for those that don't know, Medicaid is a joint federal and state health insurance program, not to be confused with Medicare. So Medicaid is for low-income individuals, families, individuals with disabilities, whereas Medicare is the federal program for seniors. So the state runs its Medicaid program through what is called MoHealthNet. So this is the state administered part of Medicaid. And the way this works is people are covered in the categories that I kind of mentioned here, which maybe I'll give a more thorough accounting of who is eligible for Medicaid in a second. But big picture, the way this works is that the state provides health insurance coverage for individuals that are eligible. They go out, they receive the medical care that they need. And then that bill comes to the state, and there's a cost sharing agreement where the state takes that bill and is able to forward, in Missouri, it's 65% of those costs to the federal government. So this is known as the Federal Medical Assistance Percentage, or FMAP, as I'm going to call it here. So the federal money covers 65% of Medicaid costs, and the state covers 35%. Just for I guess I'll back up and paint a little picture of who these folks are who are eligible for MoHealthNet. So it's kind of a complicated list, but in general, it's low-income seniors, blind, people who are blind or with disabilities, parents with low household incomes, infants, children in low-income households, rather, and pregnant women with low incomes. So for kind of a concrete picture here, if you are a family of four, the federal poverty line is $26,000 approximately. And to be eligible for MoHealthNet, you have to be at 20% or less of the federal poverty line. So that brings in this expansion portion that we're talking about. So what this means, where this terminology came from, I guess, first off, is from the Affordable Care Act, also known as Obamacare. One provision in that bill gave states, eventually after some legal wrangling through the Supreme Court, gave states the option to expand Medicaid eligibility to any individual making up to 138% of the federal poverty line. So that is where this expansion notion comes from. Like I said, Missouri's current eligibility is at 20%. If you're a parent, 20% of federal poverty line. So now expanding that threshold to 138% brings in a new pool of newly eligible people into the program potentially. And as part of this agreement, they kind of sweeten the deal and put incentives in there for the states to accept Medicaid expansion by changing this FMAP matching formula to be 90-10 rather than 65-35. So if you expand Medicaid, anyone who's newly eligible will cost the state only 10% of the costs, as opposed to 35% for anyone who's already enrolled in Medicaid. So this is really where the sort of political wrangling that you mentioned comes in here. So what's happening now is the House and soon to be the Senate. The House just made their decision, I suppose. The Senate is going to have to decide what to do because, like Rachel said, the House decided to take the portion of the budget that was recommended by the governor's office to cover the newly enrolled Medicaid expansion population, which people estimate to be about 275,000, maybe 300,000 people, and cost somewhere around $1.9 billion in bulk. They decided to not include that in the budget bills that they passed through the House and are passing on to the Senate Appropriations Committee now. So that leaves the Senate in a position to figure out what to do here. One thing that gets brought up, I think rightly so, is that the ballot initiative did enshrine Medicaid expansion in the state constitution. So there is a feeling, even from Republicans in the Senate, you can read quotes in the newspaper here saying that this is something that they believe the state has to do. So there may be some wrangling, some disagreement over that, and it's not our role to do sort of political prognostication here, I guess. But I really only see a few paths here of really the Senate has to make a decision on whether to bring this back into the budget or not. And if not, then potentially there is a court case down the line, because like I said, this is something that is in the state constitution. So if you stay with me for all of that, Dan, I can answer maybe some questions that you might have, or you think our viewers might have, if they want to drop anything in the chat. I know it's complicated once you start bringing percentages in and things are changing. So I want to take a second to leave some air and see if there's any questions.
Yeah, it all can be quite dry and also quite emotional for some people at times, depending on where you are in the on the spectrum. I just want to remind people, like Josh said, you can enter your comments and your questions into the comments section below on both YouTube and Facebook. So make sure you do that. We'll get to them. We'll pop them up on screen. Rachel, do you have any questions for Dr. Mueller?
It seems pretty straightforward. I think that the actually, yeah. So one of the questions I think maybe that would be good to ask. So I think one of the reasons why a lot of Republicans are opposed to this is the costs that are associated. And there's, some positive news for the state budget this year, but in general, we run a pretty tight state budget. And so that's a concern. Could you talk briefly about some of the work that Washington University researchers have done to show sort of the long-term costs of Medicaid expansion and how it could actually save money for the state over time?
Sure, yeah. So this is something that I think if you like us, if you spend your days watching House hearings, that this is what you hear people talk about is sort of the fiscal impact. And so the way it is projected out right now, just for starters, is that this expansion population would cost $1.9 billion to enact coverage for the newly eligible population. But approximately only 130 million of that would have to come from the state. So the rest would be covered through buy-in from the federal government. So this is obviously, this is a cost. I mean, this is $130 million that the state has to find and appropriate and put towards this program. But there's a history in other states, like Michigan, Louisiana are kind of the classic examples where expansion has been in place and people have done a pretty thorough accounting of the budgets there. There are examples of states where in the years following Medicaid expansion, the state budget has looked a little bit healthier around around health spending for a variety of reasons that I could go into, but I would probably do better to give you the summary version here from Washington University and just give you the sort of broad numbers. So the way the way the researchers from Washington University who study this very, very closely have put it is that you can expect there to be kind of a one-time upfront cost as you bring these new people into the program, but through a variety of potential cost-saving mechanisms, the long-term consequences have a range of possibilities that include actually saving money for the state relative to not expanding. This work was actually done before some additional sort of incentives were released by the federal government. So one thing that just happened recently with the passage of the American Recovery Plan is that the federal government offered an additional 5% matching percentage to the traditional already enrolled Medicaid enrollees in any state that newly expands Medicaid for 2 years, I believe. So that's kind of an initial carrot here, an additional carrot here that if you decide to expand Medicaid, that the government will foot 5% more of your already existing bill for your already enrolled population. So I think that is a consideration that's being brought to bear here as well, as you hear people kind of go back and forth on whether it's a cost or a cost saving mechanism. And so, yeah, I would definitely encourage people to go take a look at the kind of track record in other states and the work that WashU has done on this, because I think there's some range of possibilities, but also some non-intuitive scenarios that really could result in cost savings down the line.
I just want to point out that Rachel popped up a link to the science note Josh wrote about Medicaid expansion here in Missouri. So check that out in the chat. I'll pop it up on the screen real quick. Don't write that down. Just click it in the chat. It's much easier.
And that does have a few more details about the Washington University study that Josh referenced. So.
Yeah, I will say it's amazing how things move so quickly, because I think we wrote that in the month or weeks leading up to the vote last August, and obviously circumstances have continued to change economically and health-wise with the pandemic ongoing. So a lot of those numbers I think are hard to evaluate now because people's circumstances have changed. So yeah, it's the sort of thing that this is why I guess we do these Friday updates, so that we can take in the newest information and put it out there.
Josh, I'm wondering, is anything being discussed in the legislature? Is there an alternative to Medicaid expansion?
Dan, I think that is really where the rubber is hitting the road politically. I think people are having to make this determination based on their reading of ballot language and statute here, whether or not this is something that there is an alternative to. And I think like Rachel mentioned, if you follow some of the logic being put forward, that some people are making it their position that this is not something that is necessarily something that needs to be included in the budget, but people who are on the other side of the coin are just as firm, kind of saying that this is something that we are mandated to do. And I think the one thing I'll mention is that the governor's office did decide to include this in their budget. So it's really hard to kind of disentangle general positions here. I think there's some diversity of opinion even within the parties about what the requirements are here. So yeah, I don't think there's a direct alternative being proposed here, Dan. I think the idea is to try to figure this out in Senate appropriations over the upcoming weeks.
And I think the bottom line takeaway message here is that it's still just a discussion at this point. Our job is to elevate the role of science into these policy discussions and make sure science voices is heard, and the politicians are gonna hash it out. Even though it's making big headlines, this is not it's not a done deal just yet.
That's exactly right. And I think that leads well to some of the other things we were going to talk about today. So we've been hearing about sort of this this conversation on limiting public health orders in the time of an emergency, particularly surrounding COVID, and a lot of the actions that cities chose to take last summer and last fall. And this has been a continued conversation at the Capitol. The Senate, well, maybe I'll just let Josh give a little bit more background on this, but it's, something that died in the Senate and it's coming back in the Senate, and, probably have more conversations coming from the House, but nothing's over until it's passed by both chambers and sent to the governor's desk. So Josh, tell us a little more about where the chambers are at with public health orders and limitations on those.
Yeah, sure. I guess I didn't realize that is kind of the theme of what we're seeing in the health sphere right now, is that a lot of things are sort of up for negotiation. So what Rachel's referring to is a bill that came out of the House that would put kind of quantitative limits on the duration of emergency public health orders that local authorities are able to enact. So I think the version that Rachel's referring to prior to this came out of the Senate and was rejected, and I think was seen to be a little bit more restrictive than this new bill coming out of the House that'll be up for debate here relatively soon. And so in this bill, what it essentially does is limit the authority of local health authorities. So the structure sort of varies city by city, county by county, but there are local health commissions, county commissioners, health boards that in this pandemic have used their power to put things like mask mandates or restrictions on gatherings, sizes of gatherings into place. And so what this bill would do is limit orders of those types to be only valid for 15 days, after which they would have to be renewed by kind of a set of votes at the local level. And those votes would get kind of more and more difficult to fulfill. So the percentage of yes votes needed to sustain it gets higher and higher until it actually eventually becomes unanimous. And the duration of the extension of that order becomes shorter and shorter. So I think the initial period would be 15 days, followed by another possible 15-day extension, then followed by smaller increments, only 10 days at a time. So I think the broad strokes here are the same, is that the state government is looking to kind of modify the ability of local health authorities to make decisions about emergency orders during a situation like the one that we're experiencing now. But again, I think this is something that is kind of up for grabs right now, because we just saw a similar bill to this not make it through the Senate. I think one thing that I'll point out that happened actually very recently here that also goes along with this conversation. The legislature is moving forward with language that would prevent the state from enacting what people kind of colloquially are calling vaccine passports in travel situations within the state. So this, I don't think, is something that the governor's office or the legislature has any intention to do proactively. I don't think there's been discussion at the state level to enact vaccine passports for things like getting on a bus, getting on a train, getting on an airplane. So what they're doing in this piece of legislation is trying to preempt any action, I guess, and say that vaccine passports explicitly will not be allowed. So yeah, I think we're coming out of the sort of tail end of the pandemic here as vaccinations are kicking up, and I think with all of that experience behind us, the legislature is figuring out what things might look like the next time around there's some sort of health emergency.
And I think the governor explicitly said today, he made an announcement that there would be no vaccine passports mandatory that he would mandate from his position. So that's what I saw that pop up today. I think this is really one of the things I find really interesting about this conversation is that it really shows the dynamics of power between the different levels of government. So here we have, the state government, which is, a larger jurisdiction than city or county governments. And then the state is coming in and saying it's both dictating what the, local government can do, but also, from some perspective, limiting their ability to have control, which affects the people in their jurisdiction. And so it's a, there's been a lot of bills that have come up over the last couple of years. Well, I've only been involved the last couple of years, but this happens a lot at the state level in Missouri, where we have, they see overreach and local control. And so the state will come in and say that local jurisdictions aren't able to do this. And so this is another example that follows probably a long list of other issues that the state has jumped in on when they feel like local governments are maybe overreaching a little bit from what they feel comfortable with.
Yeah, definitely. I think if you listen to these discussions, you will hear the phrase local control used almost more than any other phrase in the discussion. I think that's right.
Very interesting chimes, Josh. I wonder, do you want to help me take a minute here, and we'll talk about our roundtable discussion coming up at the end of the month, since it's always also health related. I just want to alert everybody that you can go sign up, and we'll send you an invite, and we'll send you alerts related to this roundtable discussion on vaccine equity and vaccine hesitancy for rural populations in Missouri. Josh, who do we have slated so far for this roundtable event?
Yeah, we've got an exciting lineup that we're putting together here, Dan. So one confirmed speaker that we have is Dr. Jeanette Berkeley-Patton from UMKC, who has deep experience going back to thinking about public health campaigns around HIV, AIDS, thinking about kind of effective community engagement around public health strategies. So we're really excited to hear from her. And then we've also got Megan Simmons, who is a senior research strategist at the Missouri Foundation for Health, who can give us kind of the top-down, data-driven perspective. They did some great work with focus groups and surveys, trying to get a feel just descriptively for what people are saying in the state about how they're feeling about a COVID-19 vaccine, whether that is, around their concerns around it potentially, or whether they think it's something that they would like to do, but they'd like to wait and see. All sorts of really fine-grained questions that I would encourage people to dig into and to tune into our chat so they can learn a little bit more about what we know.
Absolutely, we're really excited to bring this content to you and to bring you some science information, as the case is. Rachel, do you have any more questions for Dr. Mueller?
I don't think I have any more questions. I would just say that, we'll be back here again at 3 p.m. next Friday. We don't have the topic determined yet. We're kind of waiting to see what the legislature is going to be talking about next week. They have Easter break this weekend, so they'll be back on Tuesday. But if you have topics that you're really interested in, if you are one of our, regular attendees on these Facebook Live events, let us know if there's topics you want to hear about. We're happy to, we call these science policy office hours because we really want to help you understand what's happening in Jefferson City, what's happening around the state of Missouri related to science and policy. So please feel free to reach out, either drop some suggestions in the comments here or feel free to reach out to any of us via email or social media to let us know if you have topics of interest.
Absolutely. And we're easy to reach. I'm Dan at mostpolicyinitiative.org. That's Rachel at mostpolicyinitiative.org. And that's Josh at mostpolicyinitiative.org. They're pretty easy email addresses to get. If that's all, if we don't have any questions from the peanut gallery, then I think we do have another obligation here this afternoon, another meeting we have to attend to. So maybe we'll see everybody later. We'll see you next week.
Have a great weekend.
Great.
Bye.
Thanks, everyone. Bye.